good news is it can be managed, because sometimes when people hear that diabetes diagnosis, you know, and at least you, the first one that nodded to me, it's a shocker, you know, but it can be managed. Do you kind of calm them down?
Oh, absolutely. Absolutely. And education is the key.
Yes, it is.
I tell them the best weapon you have is right up here, is your brain. The more you learn, the more you understand, then they're not so overwhelmed.
Absolutely. Now, another game changer is the amount of people who are not diagnosed. Let's talk about this, Angie. The CDC says 9 out of 10 people do not even know they're at risk.
Yes.
Goodness gracious.
Crazy.
Why?
Because they don't go see their doctor for years and years and years, and then they have this prediabetes or lingering sugars are a little bit elevated, and they don't even know it.
And look at that, 84.1 million adults.
Exactly.
That is staggering. They're not seeing their doctor, and as the time progresses, things just get worse, right? As anything in life.
Definitely.
Wow. All right, we have some risk factors for pre-diabetes. Let's talk about these for a moment. Angie, walk me through these. Yes. Weight is huge.
So excess weight, definitely, we know is a risk factor for many diseases, and type 2 diabetes, but even for pre-diabetes. Age, as we get older, after the age of 45, you have a higher risk. Genetics, if you have anybody in your family history, or if you yourself have a history, let's say, of gestational diabetes during a pregnancy, that could be a risk factor for pre-diabetes, and then that can definitely develop into type 2 diabetes. We also have physical activity, or more like inactivity, is going to be a risk factor. Not only the medical history of the person, but family history of others, like parents and siblings, is definitely a risk factor to look for. And then race and ethnicity, for example, Hispanic, African American, Asian, and some American Indian. So some of those have a higher risk.